Check the cables and lead wires for fraying, broken wires, or discoloration. Plug the ECG machine into a grounded alternating current wall outlet or ensure that the battery-operated machine is functioning. Turn the ECG machine on and input the information required. Ensure that the patient is in the supine position and is not touching the bed rails or footboard. Expose only the necessary parts of the patient's legs, arms, and chest to provide privacy and warmth. Identify the lead sites before placement. Mark the sites with an indelible marker if serial ECGs are anticipated. Wash the skin with soap and water and dry it briskly with gauze pads or a washcloth. Prepare the electrodes. For pre-gelled electrodes, remove the backing and test for moistness. For adhesive electrodes, remove the backing and ensure that the adhesive pad is sticky or moist. Place the limb leads in fleshy areas equidistant from the heart and in approximately the same place on each limb. Avoid bony prominences. Place the chest leads, ensuring accurate placement. Identify the angle of Lewis or the sternal notch. Palpate the upper sternum to identify where the clavicle joins the sternum, suprasternal notch. Slide fingers down the center of the sternum to the obvious bony prominence. This is the sternal notch, which identifies the second rib and provides a landmark for noting the fourth ICS. When the fourth ICS is located, place the V leads in the appropriate locations. V1 at the fourth ICS, right sternal border. V2 at the fourth ICS, left sternal border. V3, equidistant between V2 and V4. V4 at the fifth ICS, mid-clavicular line. V5, horizontal level to V4 at the anterior axillary line. V6, horizontal level to V4 at the mid-axillary line. Attach the lead wires to the electrodes. Ensure the machine is programmed with the appropriate information. Paper speed, 25 millimeters per second. Calibration, 10 millimeters per millivolt. Filter settings, 0.05 to 100 Hz. Obtain a 12-lead ECG recording. Instruct the patient to remain still while the machine senses and translates the electrical activity of the heart to electrical waveforms on paper. Obtain a rhythm strip if needed. Examine the 12-lead ECG tracing to ensure that it is clear. Repeat the ECG if it is not clear. Compare the 12-lead ECG with previous 12-lead ECGs. Interpret the recording and look for the following: rhythm, rate, presence and configuration of P waves, length of PR intervals, length of QRS complexes, configuration and deviation of the ST segments, presence and configuration of T waves, length of QT intervals, presence of extra waves, for example, U waves. Arrhythmias. Evaluate the 12-lead ECG for any signs of ischemia, injury, infarct, and other significant myocardial alterations. Notify the practitioner of any changes in the 12-lead ECG. Disconnect the equipment, clean the gel off of the patient if necessary, and prepare the equipment for future use.